Hi, I'm Pamela Dixon. This is my head-to-toe physical assessment video for Maryville University. I have Hamish, who has volunteered to be my patient. I told him he could wear a gown or comfortable clothing, and he chose comfortable clothing. I would first introduce myself. Hi, I'm Pamela Dixon. I'm going to be doing a head-to-toe physical exam on you. Okay. And then I would ask the patient, have you emptied your bladder? If not, you can do so now. Do you need to do that? Okay, great. I also got his vital signs. I got his blood pressure, his temperature, his pulse, his respirations, his blood oxygen saturation level, and they were all within normal limits. We also got his height and weight. When he walked into the clinic, I saw that his appearance was appropriate for the climate and his gait was very steady. We performed a vision test for distance using the Snellen chart and a test for nearsighted vision using the Rosenbaum chart. Both of those test cranial nerve 2. I've washed my hands, and so I will begin the assessment. As I go from head to toe, I will be assessing his skin pertaining to the system that we're working with. I noticed right away that his head is normocephalic. There are no rashes. He does have a little dryness on his face and his chin, and a little discoloration. It looks like he maybe got too much sun on his bridge of his nose and cheeks. His hair is distributed even and is coarse in texture but soft. The temperature to his head is normal, and his scalp moves good. Are you tender anywhere? Okay, I'm going to palpate his facial bones. Any tenderness?
No.
Okay, and no edema is noted. And I'm going to now move to some neuro stuff on his face. Can you open your eyes wide? Great. And can you shut them real tight? Perfect. Okay, and now can you smile? Frown? Puff out your cheeks. That's good. Wonderful. Now clench your teeth. Stick out your tongue. Great. Okay, and now I'm going to get you to open your jaw and close it. Okay, now move it side to side. And this is checking your TMJ joint just to make sure there's no clicking and it does move smoothly. So that's really good. Let me look at your eyes now. They are about even. You can see the inner canthus lines up approximately with the top of your earlobes on both sides, so that's good. Your eyebrows are even and evenly distributed. And now I'm going to do a test to finish with the neuro part on your cranial nerves. So I want you to close your eyes, and when you feel sharp, tell me sharp, or dull, tell me dull, okay? And
dull.
Keep your eyes closed, please.
Sharp.
Okay.
Dull. Sharp. Dull. Sharp. Sharp.
Okay. And I'm going to go ahead and do it on your arms and legs. Keep your eyes closed.
Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Great. Okay, keep your eyes closed. This is a light sensation test, so when you feel me touch your face at all, just let me know that you feel it.
Feel it. Yep. 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 Yep.
Great. That tested the 5th, 7th, and 12th cranial nerve. Now we will look at your eyelids and your eyeballs and check all of that. So you can close your eyes. I noticed that your eyelids have no edema, no rashes, no lesions. Same for your eyebrows. Your lashes don't turn in or out. There's no ectropion or entropion. And your lacrimal glands, open your eyes. Don't produce any extra teariness. Do you have any dryness in your eyes, excessive dryness? Okay, great. Your conjunctiva is very pink. There are no lesions on it. And your sclera is white, no signs of jaundice. So that's very good. I will now be assessing your pupils to see if they are even, if they react to light, and if they accommodate correctly. So if you will just look at me. Okay, that's perfect. Perfect. And they are even in size and react great. And now I want you to just follow my pen light through the 6 cardinal fields of vision. And then I'm going to also converge them towards your nose. So follow this pen light. There it is. Perfect. Okay, and now we are going to do accommodation to see if you can accommodate far vision to near vision. So I want you to look at the camera over there, and now look at me. Okay, great. And now I want you to look at the camera, and I'm going to cover one eye. Okay, and now I'm going to watch this pupil to make sure that it accommodates correctly. Okay.
Mm-hmm.
That looks good. Perfect. Okay. Now we will look at your ears. We already saw that they were symmetrical with your eyes. I will look at the outside. They both look pink. There are no lesions or dryness or rashes. And does this hurt?
No.
Okay. And what about on this side?
No.
Okay, great. I'm going to do what's called a whisper test. So I'm going to stand over in this corner, and then I'll just stand over here, and I'm going to say 3 either numbers or words or letters, and I want you to repeat what you hear, okay?
Baseball. 31. 2.
Good deal. And over here.
45. Tennis. 3.
Good job. And now we will do the Rhine test and Weber test. So the Weber test is going to test for your bilateral hearing. So I'm going to hit this on my hand, and I'm going to put it on top of your head. You need to tell me if you hear it in one ear more than the other, or in both ears the same. Okay.
Both.
Okay, good. And now the Rhine, I will test for air conduction versus bone conduction, and I will hit it, and I'm going to put it behind your ear and then in front, and you just tell me when the noise stops for you, okay?
Yep. Yep.
Okay. And that's good. Usually air conduction is twice of bone conduction, but we got to do it on the other ear to see if it's balanced.
Yep. Yep.
Okay. And now I'm going to look into your ears. Now look at the external ear canal. Let's say it is, there's no edema. There is a moderate amount of serum in there, but it's pearly gray. And let me try to see the landmark. Okay, I see all the landmark. Looks good. Okay. No bulging of your membranes. Now we'll look at the other one. This one looks good, pearly gray, less serum than the last one, and the landmarks are a lot easier to visualize because of this, and no bulging membrane, no edema. So that looks good. Now we will look at your nose and make sure that it's symmetrical on to your face and that there's no brushing. I already told about the discoloration, probably due to sun exposure. Okay. And no lesions. Looks good. So what I want you to do is I'm going to cover one nostril and I want you to take a deep breath in.
Through my nose?
Yeah, and out. Okay, so good. I'm going to do the other side. Okay, now do both nostrils. Great. Now I'm going to have you close your eyes. I'm going to put something underneath your nose and I want you to tell me what you smell. Close your eyes.
Berries.
Very good. Okay, and now I'll look in your nose if you don't mind. I'm going to just check and make sure that your turbinates look good. Perfect. So I see a little mucus, but it's not red or anything, and there's no deviation of the septum over there. And here, same thing, just a little mucus, filled up, and nothing pink, no edema, no deviation of the septum. Okay, now I'm going to look at your, the smell test that we did where I had you smell the berries, tested your first cranial nerve. And then the eye test where we had you accommodate and to the light and to distance and near vision, tested your third, fourth, and sixth cranial nerves. The hearing test we did tested your eighth cranial nerve. And now we will look at your mouth and pharynx. If you can open your mouth for me. Okay. And I can see right now your mouth is symmetrical. Now I'm going to use my light just to better visualize what's in there. So open wide. Thank you. And first I just want to inspect it and make sure that it's pink. There's no lesions I can see. I can see your teeth look good. Your gums look good. Now I'm going to look at your ducts, your Stimson ducts, which are on the sides of your mouth. And now I'm going to get you to stick your tongue out so I can raise it. And I'm just going to use this to do it. I'm going to look at your duct underneath. Open your mouth. There you go. Good. Okay, this is your Wharton duct, and I can see it very well. It's good. Sorry. Okay. And now I want you to move your tongue from side to side. Okay, now touch the roof of your mouth. Okay, well, I can see it better, isn't it? Okay, and now I want you to open up and say ah, and I'm going to look at your uvula. No, I mean stick your tongue out and say ah. There you go. Great, and I can see it's midline, it rises. Do it one more time. Okay, and you have your tonsils. Okay. And they are about 1+. There's no edema. They look good. We will now look at your hard and soft palate. So I was just giving you a break. I'm going to make you open your mouth one more time so I can look at those. Okay. And they look good. And that tests your cranial nerves 9, 10, and 12. Like I said, your tonsils, uvula look great. And now we will move on to your neck. So for your neck, I'm just going to look and make sure it's symmetrical. There's no masses on it. We will palpate it and look at your trachea. Make sure it's midline. And it is. And your carotids. Make sure I don't feel anything, and I'll listen to them in just a minute. Your thyroid, if you can bend your neck this way. There you go. And put your chin coming out. Okay, now swallow. Okay, and do the other side. Okay, good. And then I'm going to listen to carotids and your thyroid to make sure there's no murmurs heard. Okay, take a little breath and hold. Okay, breathe out. Breathe normal. Okay, it's good. So now I'm going to check your lymph nodes and make sure that those are okay. I'm going to start with your preocular. Then I'm going to go to your postocular, your occipital, your tonsillar, your submandibular, your submental, your anterior superficial cervical, post-cervical, deep cervical, the supraclavicular, and then the epitracheal, and then we will also look at your axillary. Raise your arms just a little. Okay. Can you press your neck side to side against my hand? Press. Okay, good. Now do this side. Okay, and then I want you to shrug your hands. Shrug against my hands, your shoulders. Shrug them up. There you go. Perfect. And that tests your 11th cranial nerve. We'll do a little more of that range of motion. So if you can put your chin to your chest, look up. Okay. Do side to side. Okay. Do ear to shoulder. Okay. And do chin to shoulder. Did you feel any pain with any of those movements? Great. Okay, and now we're going to go to your upper extremities in your hands. So first, I'm going to just generally look at them, see no lesions, good hair distribution is even on both sides, good coloring. The warmth is dry and warm, and your hands are warm, so that's good. I'm going to palpate them and just make sure I don't feel any masses. Does it hurt anywhere I'm palpating?
No.
Okay, I'm going to palpate the joints and just make sure there's no joint tenderness. No?
No.
Okay. Then I'll look at your nails. On them, I see no pitting, no ridges. There's no hand edema. You have good capillary refill. And I'll look at the other one too. Okay. And now I'm going to look at the strength. So I want you to push up against my hands. Okay. Now pull down. Great. And then I want you to lift your arms over your heads. Does that hurt at all? Okay. Now I want you to make a thumbs down. Does that hurt to pronate your hands? Okay, great. All right, now we will go to your reflexes. Since I'm already up here, I'm going to do your brachial, bicep, tricep, and wrist reflex. So I need my hammer. So first I'm going to hold this, relax it in my hand, and I'm going to hit this, and I should see, let me get so the camera can see, your thumb extends. You can see it move. And now I'm going to do your bicep. So I'm going to put my elbow here and stroke on my thumb, and we should see this muscle. You can see it contract a little. Got a good one over there. Okay. Now I'm going to do your tricep. So I'll use the tip of the hammer over the back right here, and we should be able to see it. Okay. And then your wrist one is just the inside of your wrist. So rest it on my hand. There you go. There you go. Rest it on my hand. There you go. Now I'm going to assess your lungs. I'm going to do the posterior first. So let me actually bring the stool over so you can sit on it facing backwards if you don't mind.
That way?
Okay. So I'll inspect his skin first. You can see there's a couple of papules here, and it looks normal color. Just a little hair, sorry. and good temperature. Normal curvature of the spine, his cervical and lumbar are concave, and then the thoracic is a little convex. Do you have any pain when I touch on it?
No.
Okay, great. So first thing I'm going to do is have him say 99.
99.
And I can feel good tactile primitives, so that's good. And then I want you to take a deep breath in and out. And I'm just looking for good chest expansion, respiratory excursion. It looks good. So now I'm going to percuss it between his intercostal spaces, and I want to hear some good resonance. Okay. I am also going to check for any CBA tenderness, and so I will put my hands over his kidneys and hit on it, and you tell me if you feel any pain, okay?
No.
Okay.
No.
Okay, great. So I'm going to auscultate the border of his diaphragm, and for that I'm going to have him take a deep breath, and then I'm going to mark it where I don't hear resonance anymore, and then I'll do the same for when he blows out. So I want you to take a deep breath and hold it. Okay, it's not working. Okay, and now I'm going to do the same on the other side. So take a deep breath and hold it. Okay. Okay, and now I'm going to have you take a deep breath and then blow it out and hold it while you're blowing out. Okay, blow out. Blow it all the way. There you go. Okay, you can breathe normal for a second. Okay. And you had it blown out, right? Okay, so I want you to do the same thing so I can do it on the other side. Okay, and it's pretty symmetrical, so that's good. I'm going to measure it. It's about 5 centimeters, and that's normal. 3 to 5 is normal, so we're good there. Now I'm going to listen to your breath sounds, and I hope to hear vesicular breathing means. And so just take some deep breaths as you feel my stethoscope hit your back. In and out. Okay, so now say 99.
99.
Say it again.
99. 99. 99. 99. 99.
Great, and it sounded muffled, so that's good. Now I'm going to have you turn around and you can sit on the bed. It's more comfortable. Okay, so once again, I'm going to just inspect the chest, make sure I don't see any rashes, lesions, or anything like that. Color is good. Skin temperature is good. Respirations seem even. No use of accessory muscles while you're breathing. Chest wall looks good. So I'm going to palpate and have you say 99.
99.
Okay, say it again.
99.
Great. Okay, and then I'm going to percuss it, and I want to hear also the resonance and whenever I do that. Okay, now I'm going to listen. Take a deep breath. In and out, just when you feel it. Now lift your arm. Okay. Now I'm going to listen to your heart, and I will go ahead and get you to lay down for that. Let me get move all this stuff. Okay. Make sure they can see you. Okay. So I'm going to listen to your heart. I'm going to listen to your aortic, pulmonic, Erb's point, and tricuspid and mitral valves. I'll listen to make sure there's S1 and S2 and no murmurs or other sounds that aren't supposed to be there. So first I want to feel your chest, make sure I don't feel any thrills or heaves. Just keep breathing normally, and I'll observe your chest expansion and make sure that it's even. Okay, and now I want to palpate your point of maximum impulse, which is along your fifth mid-clavicular line, so that's the fifth vertebrae. And then I'm going to also touch your carotid at the same time to see if they correlate. And I'll go ahead and take your pulse. Okay, it was exactly 60, so that's perfect. You're an athlete, so I would expect it to be on the lower end, so that works out good. Now I'm going to listen to your heart sounds. I'm going to do the aortic first, which is on your right second intercostal space. Now I'll do the pulmonic, which is on the second left intercostal space. And then the Erb's point, which is the third. Tricuspid, which is fourth to fifth. And then the mitral. Don't hear any murmurs. I'm going to have you lay on your left side just for 1 second, and I'm going to listen this way to your mitral and make sure that I don't hear any. Okay, and you can lay down. Now I'm going to move on to your abdomen. I'm going to inspect it and listen and palpate last. So I can see that it's flat. There's no protrusions or pulsations visible. Can you lift your head? I'm going to make sure I don't see any umbilical hernia, and it looks good, and I can lay it back down. No rashes. I'm going to listen to the 4 quadrants to hear bowel sounds. Okay, bowel sounds are normal. I'm now also going to listen for breeze over your abdominal aortic area, your renal areas, iliac areas, and femoral areas with the bell of the stethoscope. Now I'm going to percuss, and I should hear timpani over the stomach, intestines, and so forth, and a dull sound over your organs, like your liver. Okay, and I'm going to percuss your liver span and mark it. Get my pen ready. And it's 6 centimeters, so that's normal. 6 to 12 is normal. I will also now palpate and just to feel for any masses or protrusions. I don't really feel anything that feels enlarged. Take a deep breath. I'll try to. Your squeeze not palpable, so that's good. Okay, now I'm going to try to feel your kidney. So I'm going to reach under your back, and I'm going to press kind of hard. I don't feel them. That's good. Okay. And then I'm just going to palpate for your keyboard. Okay, and now I'm going to palpate your femoral and inguinal nodes and your femoral pulses. And it's strong. Probably 2 plus. Okay, and now we're going to move on to your legs and extremities. I can look at them and see, obviously, they're the same size, no edema, hair distribution is even, and we will look at the joints and make sure there's no swollen joints, that there's no pain there. So it looks good, temperature is good, and you can sit up. So let me make sure the camera can see this. Okay. So I am going to already palpated the joints. Did you have any tenderness here? Okay, now you can raise your okay. And any tenderness there in the ankle? Okay, and now just relax it. I'm going to just flex this up. You tell me if it hurts. No, no. Okay. Does that hurt?
No.
Okay, I'm going to do this one.
No.
Okay, great. So you're negative to the homicide. That's good. We are going to now do your knee reflexes. So just relax your legs and cross them. And can you scoot back a little bit, or do you want to sit on the stool? Okay. So I'm going to do your knee patellar reflex first. Here, let's maybe have you sit up here. Sorry. There you go. Just let your feet dangle. Okay. Okay. And now we'll go through your Achilles reflex. Okay. And just relax your leg. Okay. Okay. And then we're going to do the muscle straight. So if you can press against my hand. Okay. Now pull up. Great. Can you raise your knees one at a time? Okay. Great. Good. Okay. Now we're going to finish off with some fine motor movement and then some range of motion. Okay. So first I need you to put it back where we can see you. I'm going to have you sit back on my bed so they can see more of your body. There you go. I need you to touch your fingers with your thumb like this and just do good deal. And I'll do the other hand. Okay, and then rotate your hands. Perfect. I need you to rub your heel on your shin. And do the other one. Yep. I just wanted to make sure there's no jerky movements. We did the sharp versus dull test already. So if you can stand up, I need you to stand on one foot. Okay. Stand on the other. Different color. There you go. Okay. That's fine. And now I want you to bend to this side. And now bend to this side. I want you to touch your toes. While you're touching your toes, I'm going to look at the curve of your spine. That's fine. Go as slow as you can. Looks good. I don't see any moving. Now bend backwards. Good deal. Okay. And now I want you to turn like this and like this. Okay. And then I want you to, I think that's it. I also want you to stand with your eyes closed. And I'm just looking to make sure you don't sway so you have a negative rumble. You did that great. Okay, you can sit down and I'm just going to feel your pulses down here and then we'll be done. I'm going to feel your pedal and your popliteal and your post-tickle. And they all feel good. It's about 2+. Okay, and we're done. Thank you very much. Thank you.